energy to accomplish her daily tasks. She also started losing weight and noticed that she had to go to the bathroom more often than before. That is when she was diagnosed with diabetes type 2. I have been in nursing school for the past year, and during that year, I realized that the majority of my patients had diabetes. According to a 2010 Community Health Assessment, diabetes is the 5th leading cause of death here in Cumberland County, and it affects children and adults without any discrimination. We only know someone that has it, but what is diabetes? Today, I will explain what diabetes is, the diagnosis and treatments that used to help manage it. Let's start by understanding what glucose, insulin, and diabetes are and how they relate. As explained by Donna Ignatowicz, a registered nurse, and Dr. Linda Wortman in their book, Medical Surgeon Care, Patient-Centered Care, diabetes is a chronic increase in blood glucose caused by problems with insulin secretion, insulin absorption, or both. There are two main types of diabetes, diabetes type 1 and diabetes type 2. Our body produces glucose and insulin. Glucose is produced by the liver, and it is the major source of fuel at the cellular level. The normal glucose range is between 60 and 100 milligrams. Insulin is the hormone that unlocks the cell, so glucose can enter it and it can be used as energy. Diabetes type 1 is the destruction of beta cells in the pancreas. The body does not produce any insulin at this point. It can occur at any age, but it's most commonly seen in children and teenagers. Diabetes type 1 can be also caused by mumps and rubella, and also by genetic predisposition. Some of the signs and symptoms listed in the American Diabetes Association website are increased thirst, increased hunger, increased urination, weight loss. This type of diabetes could be abrupt onset. Diabetes type 2 is a disease that does not allow the body to produce enough insulin, or the body is insulin resistant. This one, it is the most difficult to manage. It may occur at any age, but it's more common in population older than 50 years old. It can be caused by a predisposition of genetics, so your dad or your mom, obesity, physical inactivity, and existence of any other chronic diseases like hypertension and high cholesterol. Diabetes type 2 signs and symptoms are thirst, fatigue, blurred vision, vascular nerve complications. The American Diabetes Association says that it's common for patients to have no symptoms with this particular type of diabetes. This diabetes is preventable. You may be thinking, well, I have some of those symptoms. Does it mean I have diabetes? Here's how it can be determined. First, you will need a medical history and a physical. This is done by your doctor or nurse practitioner, and they will do a thorough assessment, including your past and current medical issues, medications that you're currently taking, weight and blood pressure screening. There are three main tests that can be done to help diagnose diabetes. The first one is called fasting blood sugar test. This one is done in 2 separate occasions, and the patient should not drink or eat anything 8 hours prior to this test. The second test is called the oral glucose testing. This one is considered the most accurate test. The patient drinks a glucose beverage, and blood samples are drawn in hourly intervals. The third test is called the glycosylated hemoglobin assays test, also known as the HbA1c test. This test measures the average blood glucose levels for the prior 3 months. So if you think about cheating on this test, you can't. Dietary changes doesn't change the result of this test. There are ways to manage and treat diabetes. Let's discuss what those are. Diabetes type 1 and 2 can be managed with medications and lifestyle changes, like diet and exercise. The most common medications are insulin and metformin. Insulin is a protein that helps lower your glucose levels, and it is administered with a vial, a syringe, or a pump. Here I have the different classes of insulin. As you can see, they're all different colors because one size doesn't fit all when it comes to insulin. You can see them after we're done. This is the syringe. And this is the insulin pen. This one is very convenient. The other type of medication is called metformin. This is an oral medication that decreases the production of blood glucose in the liver. Lifestyle changes depend on each person, but they should be done under the supervision of a physician. Diet plays an important role in maintaining a normal glucose level. Individuals should increase fiber intake, counter carbohydrates, and decrease the consumption of alcohol and fats. Exercise improves the regulation of glucose levels and decreases your insulin requirements. Blood glucose should be tested before exercising to prevent a sudden drop of blood sugar. As we have learned today, diabetes is a chronic disease that can affect any of us. There is more than one way to diagnose it and treat it. Today, my grandmother has her diabetes under control, and she's able to continue living a productive life. Be proactive, break the cycle. Start working today towards a healthier tomorrow. Do you have any questions? Yes.
I have a family history of diabetes, so my question is, when should I start getting screened?
Every year when you do your annual physical, the doctor should order blood tests for you. If you change physicians, you should let them know.
How often do you have to take the insulin?
The insulin, it all depends. You measure your blood sugar first, and it all depends if you have type 1 diabetes or type 2. But you need to use the AccuCheck first, and then depending on the blood sugar level, then you will take it.
If I had gestational diabetes, am I at a higher risk for getting like type 2 diabetes later in life?
Yes. Any other questions? Thank you.
One more.
Do all diabetics take insulin?
Not all diabetics take insulin. Type 1 diabetics do because they don't produce any insulin. Type 2 diabetes, like I said, they either don't produce enough or they're insulin resistant. So type 2 diabetics usually either they manage it with diet and exercise, or they just need to test their blood sugar before taking it to see if they need it. Thank you.